Thank you very much. The main symptoms of anxiety are worry, probably sweatiness, palpitations, and then anxiety affects all the systems of the body. So you may have gastrointestinal symptoms like finding it difficult to swallow, diarrhea, tightness in your stomach. You could have things like muscle ache, headaches, dizziness. You could also have things like sleep disturbance, loss of appetite, and various other symptoms. But in the main, you worry more than required, and you have sweaty palms, for instance, and you find your heart beating a bit faster. One of the best ways of calming yourself is managing your breathing. And when you center yourself through slow, deep breaths, you find that your anxiety lifts. So, an easy thing to do is to find a quiet corner and take deep inspiration. So, filling your lungs with air and slowly pushing it out through your mouth. If you take three deep breaths slowly and three push outs slowly, you will find that your anxiety reduces. So I'd recommend managing your breathing as the first thing you can do when you're feeling anxious. We mustn't forget that anxiety is a normal part of the human condition. Having said that, when anxiety begins to impact upon your functioning at work or at home or at leisure, then there is a problem. At mild levels of anxiety, things like exercise, sleeping better, and eating regularly can help. But when it gets to the point where these symptoms are debilitating, then you need to go and seek treatment. At the first level, depending on whether your anxiety is related to some kind of life stress, you may have a short course of anxiolytic medication like benzodiazepines or sleeping tablets to help you sleep. But if things get a bit more serious, then you might need to have antidepressants, of which the SSRI class is very good for anxiety. Or indeed, you might have specific heart-related anxiety, where you might need for things like a beta blocker, propranolol, particularly if you don't suffer from asthma. And that's essentially the principles of treatment. But in the main, if it's of low threshold, then you might want to just focus on exercise, sleep, and dietary modification. Yes, diet can have an effect on anxiety. When you're anxious, people tend to get nauseous and find it difficult to eat. Therefore, it's imperative that when you're anxious, you actually try and eat regularly, even though small quantities. And I think also if you eat certain foods that don't agree with you while anxious, you might worsen gastrointestinal symptoms like diarrhea or stomach upsets. And as such, food has direct and indirect consequences for anxiety. There's abounding research that we human beings are social animals and we benefit the most when we're in positive, confiding relationships. So being alone of itself is a risk factor for developing anxiety and depression. And seeking out kind, affirming relationships will help you with your anxiety because you have people who you can talk to who can reassure you. So yes, being alone is not very helpful when you have anxiety.